For 4 years in a row, we've been asking ourselves the question, vaccines, which they emphasize for us, do they prevent or do they kill? It has long seemed to us that creating vaccines in record time and without much testing is insanely strange and probably should be dangerous. Unfortunately, we were right. At the end, I will include a monologue that will put everything in its place, ladies and gentlemen.
After 6 months, the effectiveness of COVID vaccines becomes negative. Explain how a vaccine with negative effectiveness saves lives and has the worst side effect profile among all vaccines in human history. So how exactly does a vaccine with the worst side effects and negative effectiveness save lives? That's a ridiculous statement. The COVID pandemic was ended by the Omicron variant. It was more contagious but less deadly.
This is Dr. Tony Rogers. In Congress 10 days ago, he said that what we were injected with for COVID has the most serious negative effects. And I'll add from myself, we still don't know everything. So, well, what do we already know? But now the hearing is in the Senate. This is not Congress anymore, this is the Senate. Dr. Jordan Vaughn.
Dr. Vaughn has treated more than 4,000 patients with long COVID and those injured by the COVID-19 vaccine at the same time. Vaderosvela S. I started the conversation. To understand not only how to help my staff and make sure they're safe, but also to help the patients my organization was responsible for. And that really made me delve deeper into understanding the pathology. And what I realized is that the spike protein, specifically the S1 subunit, is not a harmless protein. It causes inflammation, disrupts endothelial barriers, forms breakdown-resistant fibrin, and promotes many amyloid aggregates. That's what I'm studying. These effects impair oxygen delivery, damage blood vessels, and contribute to clotting disorders that manifest as many of the symptoms we see in long COVID and in those affected by the vaccine, which by now is a huge number of people. We're talking about more than 10 to 15 million people in America who are suffering from the long-term effects of COVID or from vaccine-related injuries.
This is a study by a doctor who employs 200 medical staff members and sees 170,000 patients a year. He personally treated 4,000 COVID patients and monitored the course of their illness.
Typical symptoms are rapid heartbeat, brain fog, shortness of breath, and feeling unwell after exertion. In my clinic, I use immunofluorescence microscopy to see what's happening in the blood and to look for these amyloid aggregates. Some are teenagers unable to stand, while others are active adults experiencing minor strokes with no clear cause. These aren't abstract theories. These are the real lives of my patients in Alabama and beyond. The mRNA injection, hailed as a solution, introduced a new mechanism. Lipid nanoparticles deliver modified mRNA, which instructs cells to produce a stabilized spike protein. Unlike traditional vaccines, this method causes uncontrolled spike protein production for an unknown time, and it's spread through organs like the heart, brain, vascular system, ovaries, and testes.
For 4 years, the White House, through the FBI, ordered all social networks, and they complied, to destroy any negative information. Immediately lash out with scornful smirks and criticism at anyone who tried to warn us about the dangers of these vaccines.
I'll tell you, my first encounter with vaccine injury happened in the winter of 2021. A 69-year-old man from Alabama was admitted with unexplained shortness of breath. He was my patient. I really didn't have any other reason for why he had this shortness of breath. And after the second dose of Pfizer, he really did have significant shortness of breath. I couldn't quite figure it out in a way because usually it would be a pulmonary embolism, but empirical anticoagulation and antiplatelet therapy led to rapid improvement. This case led to further investigation into the spike protein's role in creating breakdown-resistant fibrin, irreversibly activating platelets, and damaging the blood vessel lining throughout the body.
The vaccine manufacturers knew, and with the help of bought politicians, forced all the media to suppress critical opinions. They were making too many billions to stop over something as trivial as our health, like a heart attack, whether it was a grandfather, mother, son, or friend.
I've treated around 4,000 patients with long COVID, vaccine injuries, or both. Many were young and previously healthy. For those who were injured by the vaccination, their trust in government institutions was undermined. Many had to follow federal mandates. August 2021, despite legitimate doubts due to previous infection or personal health risks. They knew their body better than the agency did. Now, having become disabled, they are rejected or ignored by the systems that demanded infection, their submission.
We were forced, required, our movement was restricted. We weren't allowed on planes, for example, ours. Our daily life changed. I personally was kicked out of a restaurant twice. Our ability to study. Children stayed at home, and then from the age of, I think, 12 months, they were required to be vaccinated. This is the attending physician. And what do they think now? Maybe they considered it earlier but were hesitant to speak up, like independent researchers such as the Stanford School of Medicine professor.
If open discussion on this topic were allowed, it would be very clear. I think for most doctors and most parents, the benefit of the vaccine, the COVID vaccine for young people, especially children, was very, very small. Why? Because the risk of death from COVID for children was very, very small.
If discussion had been allowed, said professor of Stanford Medical School, if had been allowed. Discussion, that is, if we... Not freedom of speech, expression, or opinion. Obviously, when the Democratic Party is in power, then we don't have freedom.
What is the vaccine I'm taking? If I take the vaccine, what will be the ultimate effect on the probability of getting COVID? And what will be the ultimate effect on the probability of getting myocarditis if I get COVID? Right, so marginally, if I take it compared to if I don't, how will the probability of getting COVID change? It turns out that it prevents symptomatic infection for 2 months, but this drops off sharply after just 2 or 3 months. Right, so it doesn't completely prevent getting COVID. You are very likely to get COVID after that.
I got the shot, the Pfizer shot. I
had COVID
twice since then. As an example,
personally,
yes, I mean, I got 2 Pfizer shots in April 2021, and in August 2021, I got COVID.
I mean, I got the shots. Now you have a chance of getting a heart problem, and in 2-3 months, when there's a new outbreak, you get sick again, you get the vaccine again, and again you have a chance of heart problems. I now think it's doubled.
The vaccine's marginal effect is, so basically,
you might get sick regardless. Even with the shot, you can still get COVID, so whatever happens will happen anyway. Or?
Yeah, it's like playing myocarditis twice, you know, like a slot machine. It's
like playing roulette with your own heart, just to not get sick for a couple of months. Let's get back to the Senate hearings. A doctor by training, Senator Rand Paul is questioning the former director. We have an organization called the Centers for Disease Control and Prevention, which stands for the Centers for Disease Control and Prevention in the United States.
But
we need to discuss the science itself, and we can't discuss that. You know, all vaccines are good or bad. It's about specific vaccines. It concerns specific age groups and specific policies. Does the COVID vaccine prevent transmission?
The COVID vaccine can reduce the viral load in people who...
Does it prevent transmission?
When you have a reduced viral load, you will have reduced transmission. Subtitle editor, proofreader.
So the vaccine doesn't stop transmission. You can still spread the virus after getting it. In fact, over time, the ability to prevent transmission has decreased. And what we found is that the most recent figure since the emergence of Omicron is about a 16% reduction, if there is any reduction at all.
So Susan Monares is trying not to answer questions, which immediately makes her not an expert, but a participant in the discussion.
Does the COVID vaccine reduce hospitalization in children under 18? It doesn't. The statistics are unconvincing, and the reason this can't be proven is that very few people under 18 end up in the hospital.
Interesting, they ask her, the vaccine? Did it help reduce the child's hospital stay? There are three possible answers: yes, no, or I don't know. Instead, the answer was that it could reduce it. If it could, yes, then why didn't it reduce it? Senator Paul quickly asked, Marusha, are you lying?
The numbers are extremely small. In our country, there are about 76 million children under 18, 183 died, and several thousand were hospitalized in 2020 and 2021. And since then, the numbers have dropped sharply. This idea and this problem need to be discussed. The COVID vaccine doesn't significantly lower hospitalization rates. Does the COVID vaccine lower death rates in children under 18?
By the way, that's actually the most important question. We've already found out that the former director of the Center for Epidemic Prevention is lying and dodging questions.
Yes, maybe.
Maybe again. That's a ridiculous answer. No, it can't, and there's no data showing it lowers mortality rates. That's the statistics. We've studied it. When they approved it, they had this discussion in the vaccine committee we talked about. They admitted during the discussion that there's no proof of reduced hospitalization or mortality. So they said, what can we use to get people to take this vaccine? They came up with this. They said, if we give you the COVID vaccine, you will develop antibodies. So the entire recommendation for COVID vaccination from 6 months and older is based on hospitalization data, not on deaths. It is based on whether you develop antibodies or not. People don't realize I can inject you with a foreign protein weekly, measure antibodies, and you'll always produce them. It just means that immunology works. It has nothing to do with whether you should get a vaccine every week. When discussing the science, we need to address the scientific rationale for vaccinating a 6-month-old child.
Means that millions of children were given vaccines with negative effects from taking them without any positive results for these children. So was there a positive result? Yes, there was. For the vaccine manufacturers and for those who received kickbacks or returns from these manufacturers. I remember how I yelled at my daughter when I found out she was going to have her children vaccinated. And she tells me all the doctors, all the researchers, everyone who tested it says that it must be done, and urgently. Those who worked for the pharmaceutical industry, disregarding our children, should be put on trial.
A groundbreaking study questions mRNA COVID vaccine safety, challenging health officials and raising urgent transparency and trust concerns. Thus, by using accurate data on disease trends, patient treatment outcomes, and immune system analysis. Several research reports indicate that the risks of heart inflammation associated with the vaccines may be significantly higher and possibly even more dangerous than previously reported, especially among young men. Sergey is with us now to discuss this. Dr. Kurt Kirk-Milham, Senior Research Fellow at the Independent Medical Alliance for Pediatric Cardiology. Good morning, Doctor. Welcome to the National News Studio. Glad to see you.
Good morning. Thank you for having me.
A new study on mRNA COVID vaccine safety was published in the International Journal of Research and Innovation in Cardiovascular Diseases. As I understand it, tell us about the scope of this study and your main findings from it.
Only after Depardieu left the White House did such studies start appearing in the press.
So this is a collection of studies that have actually existed since 2021. We saw a signal that the vaccine product was causing problems, especially in young adults, especially in young men, leading to heart inflammation.
They already had this data back in 2021. They had it, but they didn't have the opportunity to tell us about it. Those who were receiving them, these vaccines, those who were required to get them in order to study at universities, to serve in the army, to go to work, they were forced to do it.
So we gathered all these various peer-reviewed journals, articles, and data and put them in one place, easily accessible with 42 pages and 341 references. to our concerns that this is a real problem, and these vaccines bring little benefit to healthy children and young adults.
Were you able to correctly identify the cause of myocarditis, the differences between a COVID infection and just a side effect from the COVID vaccine?
Yes, this is very clear for a number of reasons that we were able to assess. And first of all, there was an excellent study from the Nordic countries that looked at 23 million children and young people. And they found that the people who had the lowest rates of myocarditis were those who were not vaccinated. And as you increased the number of vaccine doses or used Moderna instead of Pfizer, your risk just kept going up when it came to the risk of myocarditis. Again, with a disease that is actually very mild for healthy children and young people.
Heart diseases are incredibly rare in children and young people, teenagers. Suddenly it happens to those who have had 1, 2, or 3 vaccinations. Suddenly it happens out of nowhere.
Listen, longtime viewers of this program won't be surprised at all to hear this. But I think we'll call this segment I Told You So. At the hearings in the Senate Committee of M, this morning, Dr. That was yesterday. Dr. Robert Sullivan testified about the impact of the COVID vaccine on numerous athletes. And that's, I don't know, that's what I'm told to say. It was found to be more harmful than we initially thought. I told you all of this would happen, and now Dr. Sullivan is proving me right. Look.
I found out that many hospitalized COVID patients developed pulmonary hypertension. Autopsies showed the same kind of lung vessel damage that I have. Patients with long COVID and ongoing shortness of breath have similar outcomes. Like me, their symptoms get better, but the damage persists. Now we know that the spike protein of severe acute respiratory syndrome, COV2, can damage the lungs, heart, and brain in animals. It is toxic, that's undeniable. I know it's unpleasant to hear. A study found athletes who got mRNA boosters saw aerobic capacity drop as much as aging 5-10 years in 1 week. Why does this happen?
He also had a peer-reviewed study that showed athletes lose this lung capacity. It wasn't just about athletes, it was also about him personally, and he testified. I know. If a doctor speaks against the COVID vaccine, he must be a charlatan who didn't attend the same institutions as doctors supporting it. But he says that his own lung capacity was almost cut in half. He said, on the outside, I look normal. I've lost half of my lung capacity. If I can look this normal with such damage, how many more suffer silently? And now he has pulmonary hypertension. It's a condition that makes the heart work harder to pump more blood into the lungs. He also says that the COVID vaccine raised his blood pressure. And what?
What? None of this was checked before they made us inject this liquid into our bodies? So why do we have the Food and Drug Administration? Why do we have discussions, debates of opinions? Why do we have expert conferences and so on and so on? It works on paper, but in real life it doesn't work.
This was a 2022 study. It showed that 19% of athletes whose average age, by the way, was 37 years old. Maybe I'm just at that age when I don't consider it very old, but it's really not that old. The average age was 37 years. In this study, 19% of athletes had an 8.6% drop in VO2, indicating the body's oxygen efficiency. So the lower your VO2 score, the harder it is for your body to process oxygen. And the remaining 80%, 51% of the participants, experienced an average decrease in 2.7 of 2.7%. So it's not just long COVID or shortness of breath. We're talking about very long-lasting and, in some cases, permanent lung damage in many people.
Which actually you didn't know anything about in 2020, or you did, but you really wanted to make another trillion or two. And I want to finish with a stunning confession from the vaccine manufacturers.
John Campbell has something. Here's some disturbing information about the vaccine that you didn't know. Listen, did you know that there are 2 different batches? There were batches that they tested, and there are batches that they gave you, and they weren't formulated the same way. Did you know about that? Look.
So, you are academician Josh at the Hebrew University and have connections with the States. You've studied some pretty interesting things. First, we wanted to discuss the different processes used in producing the Pfizer vaccine. There are process 1 and process 2, which were used in the trials. Give us a little information about this, Josh, if you don't mind, please.
All right. Yes, of course. So the key point here is that in the clinical trial that Pfizer-BioNTech conducted for their COVID vaccine, they used vaccine doses produced by one manufacturing process, which you called process one. But what was provided to the public after the trial was not those types of doses. Instead, they used a different manufacturing process, a larger scale process, which they call process two. That's what everyone received with vaccination. Now, the question is, well, what's the difference between these two processes? Does it matter? And it probably matters a lot. And I can walk you through some of the evidence for why we think this is important, but just to give you a general idea, I don't know all the technical details, but I understand enough, and we all learned about it. So what needs to be done to create an mRNA vaccine? You need to generate mRNA. How do you do that? Well, mRNA is like a copy of a piece of DNA. You need DNA as the template to create mRNA from it. All right, so where do you get this DNA from? Well, with the first process, they basically use the polymerase chain reaction process to duplicate DNA, right? That's what they do with polymerase chain reaction. They want to check if you have any DNA remnants in your nose that we can say, it was COVID, it was severe acute respiratory syndrome, COVID-2 or something else. Right, so they replicate it, right? That's the whole idea of polymerase chain reaction, and it's a relatively clean way to do it. And they also used a very, very high quality system using these magnetic beads to remove any impurities. After that, the polymerase chain reaction process was used again to create a template where then they use it to generate mRNA. In the second process, they used another method to create a DNA base, where they basically have a DNA template that they put into what is called a plasmid, which is a part of a bacterium. So when the bacteria, plasmids can duplicate, and then the bacteria also duplicate. And it turns out to be a much more economical, cost-effective, and scalable method. You can just have, instead of using a polymerase chain reaction machine, you just have these big vats with, I don't know how big they are, but you have these vats with growing bacteria, and they multiply very, very quickly. And then you basically take plasmids and you take their DNA and you make it linear instead of it being coiled. And then they use that to generate mRNA. But after that, what do they need to do? They have plasmid DNA and they still have bacteria in that mass, and they need to purify and clean it. And here it seems like they did a terrible job. And I don't know if you've been following any of the exposés that are coming out, where more and more researchers around the world are reproducing this finding that in the vials of polymerase chain reaction vaccine that were tested, high levels of these M residues of plasmid DNA are being found. Furthermore, we know from polymerase chain reaction's own documents, which they submitted to various regulatory agencies, that there is residual lipopolysaccharide, also known as endotoxin. This membrane, so which bacterium are they using to duplicate this? It's the E. coli bacterium, which is a type of bacteria known as gram-negative bacteria. And the membranes of gram-negative bacteria have high inflammatory activity. They're called endotoxins for a reason, right? And that's why during the process, the ampules have a higher level of this endotoxin. And again, this is based on what we know from the polymerase chain reaction documents themselves submitted to the regulator.
Simply amazing. They tested one thing, but they're selling us something else. Do you know why? Well, of course we know why, because it's cheaper to produce. But it wasn't tested and wasn't purified from harmful impurities. It reminded me of the story with the Yeltsin Constitution. Sobchak, Alexeyev, and Shakrai worked for 2 years on drafting the Constitution. They were assisted by 800 experts in all fields of social sciences, and specialists from several foreign countries helped draft it. Finally, all these 800-plus people gathered, approved it, and handed it over to Yeltsin. Where is it? They instantly trashed it and replaced it. In all key places, from their perspective. Then they gathered 8 people supposedly impartial who signed the title page of this printed constitution. And it was for this corrected draft that the people voted, believing that Sobchak, Alexeyev, Shakrai did what they had talked about many times. But no, they discussed one thing and slipped in another, basically tricking the fools with a bunch of scraps. It's the same here. They checked it seriously and tossed it out. But they gave us something else. But even if they had given us the right thing, it's unclear how it would have affected us. Because they didn't check the effects after a year, 2, or 5. And no one ever told us about the downsides and possible consequences for young people and children. And for regular people, too. People like us who had no idea that they were just experimenting on us. What will happen? Let's see how many of you die. Very interesting. So, well, I have to tell you once again, glory to the Native Democratic Party of the United States of America. Thank you, Vought. Now the summary as promised. But how? As the chairman of the Senate Committee on Studying the Consequences of COVID, that's Ron Johnson, Senator Ron Johnson. So he led the meeting where they held, well, let's say, what's it called? An interrogation, a hearing. Kennedy to our Minister of Health.
"9,252 of these deaths occurred on the day of vaccination or within 1 or 2 days. Again, I agree with you. Nobody knows how many deaths from COVID there were because the information was completely distorted. Nobody knows how many lives were saved thanks to ES. And again, I think most people are fine. If you are vulnerable, boost your antibodies, reduce the severity, that's good. There's not even a good study. There's just information, just a statement. This is compelling evidence that the vaccinated population is much more susceptible to chronic diseases than people who have never been exposed to vaccines at all.
This happens all the time. These agencies are lying to us, and we're going to change that right now.
What we found is that someone in the federal health agencies, this is interagency communication, hid the signal. They admitted there was a myocarditis signal and they hid it. They didn't warn the public, they didn't warn the doctors. So this is just one case of corruption and lies told by the Centers for Disease Control and Prevention. We have many others that we will be exposing. All right, we held our first hearing before the subcommittee investigating the cover-up of the myocarditis signal. The injection caused harm, the children's vaccine caused harm. Next Tuesday, we will hold a hearing on a study conducted by a highly reputable medical institution, which actually studied both vaccinated and unvaccinated individuals, a very high-quality study. I'm not going to take away the credit from RNS, who will be testifying on this issue. I think you know about the study that shows the vaccinated population is much more prone to chronic diseases than people who have never been exposed to vaccines at all. This is one example of science being distorted. By the way the study was conducted, and when they did it, they said, no matter the results, we will publish it. They got the results in 2000. It's still not published. We'll put it in the protocol on Tuesday. You just want to talk about what you've observed regarding the capture of the agencies you're now leading. Corruption of science. You just said that's almost your main goal, right? Trying to restore honesty and trust in science, which has been corrupted by those who pay for it. Federal health agencies captured by pharmaceutical companies, big pharma, and the large food industry. I want to give you a moment to protect yourself, but to talk about the corruption in science that you have to deal with and that you're trying to fix.
Yes, I mean, I'll just tell you one example, and I could sit here and give you thousands. In 2002, the Centers for Disease Control and Prevention conducted an internal study of children in Atlanta, Fulton County, Georgia, and looked at children who received the measles, mumps, and rubella vaccine on time. They compared them to children who received it later. That is, children who received it before 36 months and children who received it later. The data from this study showed that black boys who received the vaccine on time were 260% more likely to be diagnosed with autism than children who waited. The lead scientist in this, Dr. William Thompson Sr., said that the vaccine safety science at the Centers for Disease Control and Prevention was called into a room with 4 other co-authors. His boss, Frank DeStefano, who is the head of the Immunization Safety Office. And they were ordered to destroy that data, and then they published it without that fact. So, you know this story, I know this story, and you know hundreds of stories like this.
Hundreds of stories like this. Those who tested the vaccine were ordered. A government agency, under orders from the Democratic Party and the White House, was told to remove negativity and create a positive, honest report. That's how we lived. More to come. For that alone, they should be hung by their private parts from every tree around Washington. I'm using the words, according to some sources, of Representative Lee, that is, a member of Congress. Some say that it was Speaker of the House at the time, Thomas Reed, who said this during the discussion of the 16th Amendment to the Constitution, which actually killed democracy in the United States. He said, or maybe someone else did, I'm not sure, but this was stated: if Congress introduces income taxes, meaning a tax on people who work and earn money, they'll be taxed. If they do this, the people will hang the deputies from the trees around the Capitol. Unfortunately, they did introduce it, but in a cunning way, and the people didn't hang them. While it would be right and great to do that, there would be no tax. I'm afraid they won't hang these ones either, but they really should. There's still a lot to talk about, like about harmless vaccines, and there's a lot to say about the harm of vaccines. I focused on topics about children and heart effects, and briefly mentioned autism at the end. A lot happened, to be continued. A lot more. Still, it would be good to hang them up, of course. That's it for now. See you next time.